Hello, my name is Paige Henry. I live in Rolla and I'm starting the Radiologic Technology program this fall at RTC. With that being said, my speech is about the good that comes from the effective communication in the radiology field. I'm going to start off with a quote that I came across by Peter Drucker, who said, "The most important thing in communication is hearing what isn't said." This can be true in many situations throughout life, and especially in the health field. After listening to my informative speech, my audience will know the importance of good communication with patients as well as co-workers and other professionals in this field. First, I'm going to talk about the various uses of nonverbal communication. For instance, writing, professionalism, knowledge, gestures, reactions, etc. It is very important to have proper communication skills in this health field in order to make a good first impression with the patients. In order for the patients to feel comfortable and remain cooperative throughout the image processing, you want to remain relaxed, yet firm, and maintain professionalism. Small gestures and interactions, like smiling and being energetic, will help the patient be at ease with the situation or whatever they are dealing with. Another use of nonverbal communication that is used with every patient is written communication. When technologists take x-rays of patients, they have to fill out paperwork, which is the final documentation and communication of the results, and then send it to the radiologist. The radiologists then have to read the paperwork, observe the x-ray, and then write their own paperwork and send it to that patient's doctor. According to Donnelly and Strife, there are 3 attributes that a healthcare provider must demonstrate, which are clinical competence, effective communication, and the ability to carry out an ethical decision. Effective communication is classified as both nonverbal as well as verbal. Effective use of communication skills will help in documentation of patient reports, professionalism, and help the patient feel more comfortable. Verbal communication is another important aspect of effective communication in the radiology field I'm going to talk about. Along with making patients feel at ease by the usage of kind gestures and body language, the correct use of words and messages will help the patients understand what procedures are taking place and what is going on. Being in a hospital can be sort of a scary experience depending on what the reason is, and meeting the technologist who is taking your x-rays can have a big impact on the patient. First impressions are everything. For example, some patients may be in a serious pain from a broken bone, or the use of a sincere professional body language, attitude, and choice of words will help them to trust the technologist performing the x-ray and maybe calm them down enough to get a decent image. Getting the patient to cooperate will allow them to be in and out of the imaging room quicker and easier. According to the Institute for Healthcare Communication, the connection that a patient feels with his or her clinician can ultimately improve their health, mediated through participation in their care, adherence to treatment, and patient self-management. This is a powerful quote that captures the meaning of how good communication between the technologist and the patient can affect the patient's health. Positive energy and compassion are what patients seek to find, which will then carry out with them. Verbal communication is also important when communicating with other technologists, doctors, or any other coworkers in the workplace. Patient records and histories need to be shared to help justify or diagnose problems for the patient's benefit. In conclusion to this topic, correct use of verbal as well as nonverbal communication is very important for any type of success in this field. Great communication equals out to great health care, which makes patients very happy and comfortable. Thank you.